Hello, my name is Dr. Neal Patel, and I'm a urologist at Advanced Urology. Today I'll be talking to you about overactive bladder. This video is for patients who may experience excessive nighttime urination that's affecting their quality of life, patients who can't make it through a long journey in a car without having to stop multiple times, people who can't make it through movie theaters or know where all the bathrooms are at the local mall. This video is for people whose quality of lives are severely affected by the urinary habits. Today I'm here to talk to you about options and know that this is not normal and that it can be fixed. Overactive bladder is a condition of urinary frequency, urinary urgency, nighttime urination, and complete lack of control of urination. Over a quarter of Americans over the age of 50 suffer from overactive bladder. It has been linked to deaths in falls in the middle of the night, and it is not a normal part of aging. Here at Advanced Urology, we pride ourselves in four things: excellence, team, outcomes, and maintaining a world-class care center. We are the world's leading and only center of excellence for the Medtronic InterStim device for overactive bladder. We have a wonderful team of experienced professionals dedicated to helping you at every step of the way. We track our data to ensure the highest quality outcomes. And our world-class center contains new, clean, modern care in one facility, which is convenient and cost-efficient. In order to understand overactive bladder, we need to understand normal urination. As the kidneys filter blood, they eliminate toxins in our urine. As the bladder fills up with urine, we start to feel the urge to urinate at about 75% full. At about 100% full, which is about half a liter, we start to develop the inability to hold our urine and we have to go. In patients with overactive bladder, even a small amount of urine can cause them to feel like they have to go to the bathroom frequently and urgently. As the disease progresses, this can lead to loss of complete urinary control and cause leakage. At Advanced Urology, we have a 5-step plan to treating overactive bladder. The first step is lifestyle changes. This includes diet, exercise and physical therapy, managing your fluids, having good sleep, weight loss, and stress. These are critical and important to managing overactive bladder. This includes changes in the diet to prevent irritants that can cause us to have an overactive bladder. Exercise and pelvic floor physical therapy can help us lose weight and strengthen the pelvic floor muscles, which can reduce overactive symptoms. Modifying our fluid intake to make sure that we are taking in a proper healthy amount of fluids at the correct times can help us reduce certain symptoms based on the time of day. Getting great sleep is really important in patients with overactive bladder. It is very important to also evaluate patients for sleep apnea, which can also be a cause of getting up at night to pee. Weight loss and stress management are equally as important to staying healthy and decreasing inflammatory markers in our body. So the second step is treating you with medications. Medications are in two different classes. One is called anticholinergics and the other one is called beta-3 agonists. Anticholinergics work by relaxing the receptors in the bladder, which can cause relaxation of the overactivity and treat the symptoms, but doesn't necessarily treat the underlying cause. Medications can definitely help improve your quality of life, and it may be the right thing for you. It's just important to note that this fixes the symptoms, but not the underlying problem, and can come with side effects, including dry eyes, dry mouth, constipation, confusion, dementia, drowsiness, palpitations, and blurry vision. Recent studies have also shown that anticholinergics can lead to early dementia. Many of these medications can be costly to you, although your provider should be able to find appropriate medicines to help with your symptoms that aren't terribly costly. Also, it's important to know that the Beers criteria, which is put out by the American Geriatric Society, actually advises against use of anticholinergics in patients over the age of 65. The other medication that's commonly used is a beta-3 agonist called mirabegron, which is also called Myrbetriq. It works in a completely different way than the anticholinergic drugs, but in the same way relaxes the bladder. This again is something that fixes the symptoms but doesn't necessarily fix the underlying cause, and it can improve your quality of life. It does also have side effects like all other medications, which can, in this case, include increase in blood pressure, headache, tongue swelling, constipation, and diarrhea. This can also be costly, but it totally depends on your insurance. Step 3 is fixing the underlying cause. So if steps 1 and 2 do not help you, we have options to get you to a better life. And that includes using technology called InterStim technology made by Medtronic, where we go in and we tell the nerve to send the right signals to the bladder. In general, the brain should always be sending a signal to the bladder to keep it calm. And in many instances, that signal is disrupted. When that signal is disrupted, the bladder goes back down to a more primitive state and becomes naturally overactive. With the InterStim technology, it allows us to introduce the signal back to the bladder and allow it to calm down and function in an appropriate manner. This treatment is safe. It treats the underlying cause. It is completely painless. It's outpatient, covered by insurance, very effective, and we are one of the world's leading experts in this procedure. If that procedure doesn't work or it's not for you, we can also do something called intravesical Botox. Many of you may have heard of Botox being used elsewhere in the body. It can also be used in the bladder to relax the bladder muscle. Botox is safe, effective. It's also covered by insurance. And it's always a good extra adjunct in patients with advanced cases who are otherwise not responsive to the nerve therapy. It is also painless, and it's an outpatient procedure. Here at Advanced Urology, we offer you a 5-step journey to your success. Step 1 is your initial visit, which can be done online or in person. Step 2 would require some minor non-invasive testing. Step 3 would be a follow-up to review those testings and decide what treatment is right for you. Step 4 would be a minor procedure should you need it in our surgery center, which is completely outpatient. And step 5 is getting you back to your normal life. What to expect when you come to Advanced Urology? We offer same-day, next-day appointments. All of our diagnostics and procedures are designed to have minimal to no pain. There are no major surgeries involved in correcting your overactive bladder. All therapies we use are covered by insurance. We provide you a personalized treatment plan and path to get you great results. Just know that at Advanced Urology, we have talented people that focus on treating your disease. We use advanced techniques that offer less side effects. We are always at the latest edge technology to provide the best options and outcomes to you. We are all thought leaders in the future of medicine and continue to push the envelope. And everything that we do is centered around the patient and outpatient medicine to get you in and out and back to normal life. Thank you.
Overactive bladder is a constellation of symptoms that include frequency, urgency, getting up at night to pee, that can be very irritating for women and men who have these symptoms.
It actually started, I noticed it early last year, having to go to the bathroom more and more, and started seeing Dr. Patel in July. Dr. Patel made me feel very comfortable. It was not an easy thing to go and discuss, but he completely understood. He drew diagrams to kind of show me how the body functions, because I don't know those things. And he's just been an amazing person to speak to and interact with, answering any questions that I have.
I think she's progressed phenomenally. To have someone like her who was going to the bathroom every 20 minutes, having urgency and leakage and pain, to going to a point where she has none of those symptoms and it's not driving her life or affecting it in a way where she can't do her normal activities.
My treatment has been great. The anxiety from the overactive bladder is completely gone. What I would say to someone who is embarrassed to seek treatment for their overactive bladder is don't be. It happens to more people than you realize, and the sooner you get help, the sooner you can start living.